Hi, in this video I'd like to talk about yet another type of uterine malformation. Today's topic is bicornuate uterus. Now this type of uterus, we also call it as a heart-shaped uterus because of the diagram here. Let's take a look. The heart shape here is clearly evident because of this indentation towards the inner cavity of the uterine cavity. Now you can see this looks very similar to a septate, but there's no septate actually present. It's because of a deformity during the early days of pregnancy within these types of patients. So they are born with these types of uterus. So these types of uterine bicornuate also shares limited volume, as you can see here. So it's supposed to have a pear shape. Now it has a heart shape. So you can imagine that there's some volume missing here. So it can lead to a pregnancy loss during your pregnancy. So patients with any types of uterine malformation, regardless if it's a didelphys, unicornuate, bicornuate, all of it are considered high-risk pregnancies and can potentially lead to miscarriage, especially late miscarriages because of how limited the volume is. Although you can get pregnant, fertilization can happen, implantation can happen, but it can lead to pregnancy loss where maybe the fetus is expanding and growing so much bigger than the available volume for it to grow. For example, if it implants here itself, we can see that the myometrium here is also quite thin. It may lead to a potential uterine rupture as well. A uterine rupture is much more severe. It can potentially lead to massive internal bleeding and then also threaten the mother's life. So our management for this type of a condition is that we need to do surgery for you. So we don't recommend anyone with this type of uterine malformation, regardless of any type of uterine malformation, you must get surgical treatment to restore the shape and size. So you don't want to bear any risk when you go into any type of pregnancy. You want to eliminate the risk before pregnancy, restore the shape and size, and then you can have a risk-free full-term pregnancy. So our management of this condition is that we will use a hysteroscopy and also laparoscopy to actually remove this indentation and then fuse these two cavities together using 3D laparoscopy. We call this a uterine fusion surgery or uterine unification surgery because we want to unify these two separate uterine cavities into one. So we won't be removing this tissue, we will also be using it to actually connect these two cavities so it has a healthy pear-shaped volume. Remember, always you want a pear-shaped size and volume for uterus. You have this type of uterus, you have a successful pregnancy. So share this video to anybody who's having some type of a uterine malformation. It can be didelphys, it can be bicornuate, it can be unicornuate. All of it can be treated here at Antai Hospital. We offer a full refund guarantee, full contractual treatment. If you receive our treatment and miscarry again, then we will refund your whole treatment fees and costs. Get in touch with us today.